So what are the criteria for diagnosis of diabetes mellitus? Here we are going to talk only blood sugar and other confirmatory test, hemoglobin A1C. When hemoglobin A1C 4% to 5.6, it is normal, normoglycemic condition. Hemoglobin A1C 5.7% to 6.4%, it is impaired blood glucose or pre-diabetic condition. When we call a patient is diabetic, if hemoglobin A1C is more than 6.5%. The fasting blood sugar level, if less than 100 milligram per dl, it indicates normal. But if fasting blood sugar level is 100 to 125 in between, it is pre-diabetic condition. If fasting blood sugar level more than 126 milligram per dl, it is diabetic. What else? Oral glucose tolerant test, shortly called OGTT. Normal person supposed to be less than 140 milligram per dl. But when oral glucose tolerant test more than 140 but less than 200, it is pre-diabetic. But if the oral glucose tolerant is more than 200, it means patient are diabetic. What else? Random blood sugar level. If it is more than 200, it indicates they are diabetics. According to the American Diabetic Association, they said a person supposed to be target hemoglobin A1C less than 7%. So individualized based on duration of disease, age, life expectancy, comorbidity, or known cardiovascular disease. If it is more 6.5 or less, glycemic goal may be appropriate based on above criteria. But American Association of Clinical Endocrinologists, they said hemoglobin A1C is supposed to be, target supposed to be less than 6.5. Here we say both American Diabetic Association and also American Association of Clinical Endocrinologists both said preprandial means before eat, plasma glucose level supposed to be 80 to 130 milligram per dl. But postprandial, after it, plasma blood sugar level supposed to less than 140 milligram per dl. It should be the target blood sugar concentration. What else? Blood pressure supposed to be less than 140 over 90. Lipid target should be low density lipoprotein less than 100 if patient do not have any cardiovascular disease. But if patient have a comorbidity, if patient has a cardiovascular disease, its target should be less than 70 milligram per dl. Triglyceride level less than 150. HDL level greater than 40, because HDL, high density lipoprotein, is a good cholesterol. They act as a scavenger. They remove the bad cholesterol from heart to the periphery. and LDL level greater than 50 for the women. For men, greater than 40. Microalbumin, random collection supposed to be less than 30 microgram per ml. This is the target for diabetic patient.